Whoop, sorry, I just pressed record there. And then, so to contact a health educator, you can fill out our online form at lupus.org/health educator, or you can call them at 1-800-558-0121 extension 136. So again, don't feel like you have to memorize that. We'll send that out in the slides and in the recording afterwards. So our Take Charge 12-week email series is an educational email series for people with lupus, including those recently diagnosed. When you sign up for this, you'll get an email from our health education specialist with tips and resources that can empower you to take charge of your health. This series covers important topics such as identifying and tracking your symptoms, sticking with your treatment plan, and getting the most from your doctors and your doctor's appointments, just to name a few topics. So just a couple more slides. We have our different services, our expert series, which is a podcast. I know everybody loves podcasts. I love podcasts. So it's a monthly educational podcast where our team interviews experts in the field about topics that are important to you. And then we also have over 150 support groups as well. And, with COVID-19 and the pandemic, those support groups that were normally in person have been brought online and are being done via webinar like this one on Zoom. But we're hoping to go back in person by 2022. And so hopefully even by being online and in webinar form, some people have been able to access that maybe they haven't been able to come to a support group before. So I encourage, if you're interested in that, check out our website for our support groups. And then we have Lupus Connect, which is an online support community where members can engage with each other and ask questions as well. So, and then ways to get involved. So near and dear to my heart, we have our Walk to End Lupus Now program. We're going to be doing a big national virtual celebration on Saturday, October 16th. And that's where we gather from across the country to celebrate and walk. We have our Make Your Mark program. If you want to do something fun and raise money for lupus, you can do that. There was an example the other day of a company doing a big cornhole tournament and raising money for lupus. So, whatever you're passionate about, you can raise money for the cause. Then we have our Virtual 6 challenge where you compete to run 6 miles over 6 days. You can paddle, you can swim, you can jog from August 23rd to August 28th. And then finally, one of the biggest tools and most powerful tools really is your voice. And so becoming an advocate. And each year we have a public policy summit on Capitol Hill that's been virtual the last couple of years, but meeting with your lawmakers both on a national level and local level to affect change and policy for lupus. We have a network of chapters, offices, support groups. So again, I encourage you to, get local and go to lupus.org/chapters, but really just, go to lupus.org, check out our site. And again, I'm going to send out this information afterwards so that everybody has the information, but this is our Twitter handle, our Facebook. If you want to stay probably the most up to date, definitely follow us on Twitter and join us on Facebook, because that's going to be the most up to date way to get alerts as well. So with that, any questions from anybody on the phone? I'm going to turn it over to our next presenter. All right. Well, I'm excited to introduce our next speaker. She is a pediatric rheumatologist and associate professor of pediatrics at George Washington University School of Medicine. And she's the chief of rheumatology at Children's National Medical Center. And as chief of rheumatology, she is focused on expanding the division of rheumatology at Children's National and introducing disease-specific clinics, including lupus and arthritis. And so now I'm excited to introduce, to present on childhood lupus and updates within childhood lupus, Dr. Sangeeta Sule. So Dr. Sule.
Thank you, Zach. I'm excited to be here. Thank you for the invitation. I have to say again, just stress how important the Lupus Foundation of America is in getting research going in lupus, getting patients with lupus connected to one another. And so I thank you all for taking the time out of your busy night to join us for this event. It's really a great foundation. So thank you. Zach, should I go down the slides or?
I can advance here for you if you'd like.
Okay, thank you. Next slide. So lupus, as you all know, is a chronic autoimmune disease. It's episodic with flares and remissions, and it can affect almost any part of the body. Next slide, please. The diagnosis is made both in children and adults based on your symptoms and labs. So once you go to the doctor and the rheumatologist, they'll often get blood work. And one of the first things they check is something called an anti-nuclear antibody. In most patients with lupus, this is one of the first tests that's positive. Then as you continue on, we'll check other things that will help make that diagnosis as well. Lupus is much more common in females compared to males, almost 10 times more common in females compared to males. Next slide, please, Zach. So childhood lupus is actually pretty common. Out of all the lupus patients, children represent 15 to 20%. And it affects between 5,000 and 10,000 children in the US. It's much more common as kids enter teenage years, so after the first decade of life, like after age 10. And it's more common in those of Asian or African American ethnicity. Next slide, please. So how do we make the diagnosis of lupus? I mentioned earlier that one of the blood tests that we'll often check is something called an ANA, or anti-nuclear antibody. But there are other lab tests and clinical things that we look at. To make a diagnosis of lupus, you have to have a mix of things going on inside your body, so what we call clinical criteria, things that you and your doctor will see, so different rashes, kidney involvement, blood test abnormalities, and then the immunologic criteria, so things that say that this is an autoimmune disease, that the immune system is confused and attacking the body. So things like the anti-nuclear antibody, and then those other things you see listed there that tell us that the immune system is out of balance. Next slide, please. So as I mentioned, lupus is a varied picture. So one person with lupus may have a rash. Another person with lupus may have really bad joint pain, and another person with lupus may have kidney disease. But it's all called lupus, even though it can affect so many different parts of the body. Next slide, please. So how do we go about treating this? Because so many different parts of the body can be involved, and it can vary in different people, the treatment varies based on what's going on in your body and what you and your doctor decide is the best treatment for you. Some of the things I list here are universal though. So no matter what part of your body is involved, sunscreen is really, really important. We know sun can trigger flares of lupus. So sunscreen, at least SPF 30 or above, is really, really important, especially on a day like today where it was so hot outside here in DC and you sweat as you're going outside. It's important to reapply it. So putting it on in the morning is great, but reapplying it during the day is also really important. Anti-inflammatories, if you have joint pain, can be really, really helpful. Hydroxychloroquine. So this is the mainstay of lupus, no matter what's going on inside your body in terms of what other parts of the body lupus is affecting. Hydroxychloroquine has been shown to help prevent future flares of disease. It can help prevent some of the complications of lupus. So that's important no matter what's going on. Prednisone and immunosuppressive agents kind of depend on what organ system is involved with your lupus. Next slide, please. So what are some of the new treatments? Our goal really for patients with lupus is to treat you, but not cause too many side effects. So the goal is to kind of get your immune system back in balance, but also to let you lead happy, healthy lives. So one of the things that is a focus, I think, for newer treatments of lupus is to treat the disease with less toxicity. So belimumab is one of the first FDA-approved treatments for pediatric lupus, and in particular to treat skin and joint manifestations. And a recent study has shown that it may also be effective for adults with kidney disease. And so as we start to learn more, I think some of the treatments that we use for adults will trickle their way down into the pediatric age group. Next slide, please, Zach. Other ways, as Zach mentioned, one of the things that I think is the hardest for patients for lupus is even if you go to the doctor and the doctor tells you, oh, your labs look great, you yourself may not feel well. Like you may have tiredness. So how do we incorporate that into how we're treating you? So some of the ways that we're trying to do that is incorporate what you tell us into what's called improvement index. So how can we tailor your medicine to help you feel better? So this is a new model that includes what the physician sees, but also then includes what the parent assesses or what we feel together is going on in your quality of life. And then assess internal organ involvement and come up with a way to better tailor your medicines for you. Next slide, please. The other thing to keep in mind is lupus can be an isolating disease in that a lot of people in the world haven't heard of lupus. I think that's the importance of the Lupus Foundation of America, getting the word out there that lupus is a real disease that can affect kids. And so a lot of kids go through, I think, depression and anxiety as they're trying to work with their peers, go to school, maybe missing school because of not feeling well or because of the medicines. And so a lot of these kids can get depressed or get anxious. And it's really important to address that. As parents, as kids, as providers, it's okay to experience these symptoms. We just want to address it and make you feel better. That may be through talking about it through support groups like Zach mentioned in the Lupus Foundation of America, or talking to a psychologist, talking to whoever you think would be helpful. Next slide, please, Zach. So the great news about pediatric lupus, I think because of research, because of input from all patients, parents, family members, the survival is great. So 5-year survival from the time a child was diagnosed with lupus is 100%. 10-year survival is greater than 95%. So I think outcomes are really, really outstanding by working together. Next slide, please, Zach. So how can we make sure that you as a child or your child yourself can have a nice outcome with lupus? So there's certain things that are thought to make lupus worse or make lupus flare. So we talked about the sun and how important it is to avoid the sun. I usually tell our patients to try to avoid going out in the hottest part of the day, usually from 10 a.m. to 2 p.m., where the sun is the highest. Make sure to wear sunscreen or sun protective clothing. Other things to avoid, some drugs such as Bactrim or sulfa drugs are thought to increase sun sensitivity and lower blood counts in patients with lupus. Alfalfa sprouts and things that may boost the immune system, such as echinacea or things for colds, may actually boost the immune system and make lupus flare. So it's really important that you check with your doctor before taking anything. Next slide, please, Zach. So what are the things, so we talked about how patients with lupus in childhood survive. What we want them to do is survive and thrive. So there are things that that can cause morbidity or problems in lupus for kids that we want to try to avoid. Those are things like short stature, low bone density, infections, and heart disease. Next slide, please, Zach. So one of the things that's important, especially in people who are taking a lot of prednisone or steroid medicine to keep their lupus under control, is to make sure that kids have good vitamin D levels and calcium supplements. So this chart just lists what's recommended, just baseline. You and your doctor will work together to decide what the optimal dose is for you. We do that in clinic a lot of times by monitoring vitamin D levels, making sure they're adequate. Because one of the things that's been shown is that vitamin D, if it's too low, may also make lupus flare. So it's really important to keep your vitamin D levels up. That can help bone health and help your lupus. Next slide, please, Zach. So the other thing to just be aware of is that the longer your disease isn't under control, so the more active your lupus is, the higher the risk of heart disease. This usually doesn't happen in kids when they're kids. This is more of a problem as kids get older or in adults with lupus, that cardiovascular events, so things like heart attacks, may be increased in patients with lupus who've had really uncontrolled disease for a long period of time. So it's really important that kids with lupus know this so that they know taking their medicines is important. Next slide, please. So what does it mean for kids who have lupus? That it's a chronic disease. It's something they'll have to deal with every day, which can take a lot of mental energy to come to that realization. It's episodic and unpredictable. You can have good days and bad days, but you don't equal lupus. Lupus is not going to take control of your child. It's not going to take control of you. And we'll work together to make sure that doesn't happen. Next slide, please, Zach. So it really requires a team. It requires the child, family, friends, school, doctors, nurses, everyone working together to make sure that you are in charge, not the lupus. Next slide. So in the pediatric team, that includes the child, the family, the providers, the nurses, everyone in your care team taking care of you. That can involve, as children start to get older, having visits without parents, putting kids in charge of what they're doing, discussing the illness, making sure that they know what medicines they're taking, and so that as they transition to adults, they know how to manage the lupus. Next slide, please. So some of the questions that I often get from parents, I wanted to go over in this next set. Next slide, please, Zach. So the first one is, why did my child get lupus? We don't know. We don't know why someone's immune system begins attacking their bodies. It wasn't caused by anything anyone did. It's not the child's fault. It's not the family's fault. It's no one's fault. We don't know yet. We think there may be certain disease in the immune system, genes in the immune system that get activated, but we don't know for certain. So it's definitely no one's fault. And I want to stress that. Next slide, please, Zach. Can vaccinations trigger lupus? No. And it's really important that your child gets your vaccines. The only thing to be aware of is that live vaccines like the measles, mumps, rubella, or MMR, and nasal flu sprays shouldn't be given for kids who are taking immune suppressing medicines because they can't fight off that live virus vaccine. Next slide, please. So I want to touch briefly, like Zach mentioned, about the COVID vaccine. It's now approved. The Pfizer vaccine in particular is approved for children ages 12 and above. And the CDC guidelines for this COVID vaccine recommend that children get vaccinated because children can still get sick from COVID and spread COVID-19 to others. So it's recommended that kids get vaccinated to help protect themselves and others. Next slide, please. What does that mean for kids with lupus? In our clinic, we're still recommending that kids get the vaccine, the COVID vaccine, because getting COVID infection would be so much more harmful than any potential side effects from the vaccine. That includes this new risk of COVID vaccine and reports of myocarditis. As you may have heard, myocarditis is inflammation of the heart muscle. There have been some reports that some patients who've gotten the COVID vaccine had increased risk of myocarditis. This seems to be self-limited, so it just kind of goes away by itself. Whereas the COVID infection, especially in a patient with lupus, can cause inflammation in almost any part of the body. So the other question that comes up is, what should you do with your medicines if you're about to get the vaccine? And as Zach mentioned, you'll all get this slide, but this is from the American College of Rheumatology, just modifications to any medicines that may need to happen before you get your vaccine. So hydroxychloroquine, no modifications are needed. You can keep taking it and go get the vaccine. Don't have to worry about anything. If you're on a low dose of prednisone, same thing. If you're on mycophenolate, Assuming that your lupus is stable, it's recommended that you don't take the mycophenolate 1 week following each vaccination. But of course, this depends on what you and your doctor decide together. If your disease isn't stable, that may not be possible for you to hold the mycophenolate. It's not that stopping or starting any of these medicines would hurt you in any way when you get the COVID vaccine. It just may make the vaccine a little less effective in you. Next slide, please, Zach. So will my other children get lupus? Can they be tested? It's very rare for multiple people in the same family to get lupus. It can happen, but it's very rare, and it's very rare for siblings to get lupus. It's not recommended that kids get tested unless they actually have symptoms. And the main reason for that is family members of a child with lupus can often have that positive ANA or anti-nuclear antibody test. And that test by itself doesn't equal lupus. We just talked about how it's multiple things, both clinical and lab, that make a diagnosis. So if a child had a positive ANA, it doesn't equal lupus, but it may create a lot of anxiety if it's tested and found, and it's not been shown that testing it has any benefit. Next slide, please, Zach. So in conclusion, lupus is a chronic disease, but children can lead happy, healthy lives. It takes a village. Patient, family, friends, support system, great organizations like the Lupus Foundation of America are so critical, and medications can control the disease. Thank you.
Great. Thank you so much, Dr. Sule. Really appreciate that presentation. I jotted down a note. One of your slides had mentioned, especially children with lupus can experience anxiety or depression, or in conjunction with all the craziness of being a kid and everything that goes into that. But have you, over the last year and a half, with everything going on, noticed an increase in that in your clinic? Have you seen more kids coming in with higher anxiety, or I guess maybe you've seen them by telehealth, but I'm just curious if that's increased.
Yeah, thanks for bringing that up, Zach. That's a really important point. Now, because kids have been so isolated with COVID, we've seen even more anxiety and depression. So not only are they dealing with lupus and how they're feeling, they're dealing with just being isolated and not being able to interact with their friends. So yes, we've had a big increase in anxiety and depression. Mm-hmm. And I think it's really kudos to the kids because they bring it up in clinic and tell us how they're feeling so that we can act on that and get them into the resources that they need.
Mm-hmm, mm-hmm.